For the very few in the audience that don't, this is John DeTusa. He has been the dean of the School of Science through the pandemic, and has done so much to take us through our new phases, and has helped with establishing the center that we now have. So I think Dean DeTusa would like to say a few words and then introduce our Chancellor, who has come to say a few words as well.
Thank you, Bonnie. And thank you, Pam. I really appreciate you sharing that difficult story. And I think all of us are deeply touched. I think you wouldn't be human if you didn't have a tear in your eye after hearing what your family has been through. And it provides incredible motivation for this center. I don't think we need any further motivation for this work. I do have the difficult task of following that, and that is not easy. I also want to thank your family for the work that you've been doing for the hydrocephalus community. It really is both impressive and inspiring. I've enjoyed the day very much. It took me away from my usual administrivia to hear about science, first from our wonderful students, and then from both sides of Michigan Street here. So it was really nice to see all of that and to hear what's going on, and even the talks from elsewhere. So thank you all for making this a really special day. But now it's my distinct pleasure to introduce the interim chancellor of IUPUI, Dr. Carol Ann Murdoch-Kinch. Carol Ann is a trained dentist. She attended the IU School of Dentistry at IUPUI as a graduate student, pursuing advanced dental specialty training. It's following you, you know, that I'm stumbling all my words. You know that, right? Okay. Attended the IU School of Dentistry at IUPUI as a graduate student, pursuing advanced dental specialty training as well as her doctorate. Here, she learned the power of collaborative interdisciplinary clinical research and interprofessional collaborative care, which inspired her to develop and lead interprofessional education and collaborative care programs later in her career. After service on the faculties of the University of Detroit Mercy and at the University of Michigan, Dr. Murdoch-Kinch returned to Indianapolis and to IUPUI, and we are very glad that she did in 2019, when she was appointed Dean of the IU School of Dentistry. She was named interim chancellor this past June, and she took on a very difficult job. Again, we are very grateful for her work as interim chancellor. Please help me welcome Carol Ann Murdoch-Kinch.
Thank you. Well, thank you so much, Dean DeTusa. And thank you all for being here today at this inaugural Hydrocephalus Research Symposium. I'm so glad to see so many people in the room, and also I acknowledge there's quite a few of you joining us virtually online. I want to recognize our partners at Johns Hopkins University, Purdue University, IU Health, and the IU School of Medicine, as well as the team here in the School of Science. I'd also like to offer a special word of thanks to Dr. Bonnie Glaser-Yost for her leadership and vision, not only for organizing the symposium, but for advancing such exciting and promising research towards treatments and cures for hydrocephalus. Finally, my deepest thanks to Pam Finlayson and her family for being here and for sharing your daughter and sister's Kate's story. So powerful, and as John said, you know, My heart is beating fast. You've touched all of us, but reminds us of the reason why this is so important that we work hard to find a cure. Knowing about Kate, your family, and the important work you are doing to support hydrocephalus research puts heart and soul into what scientists and clinicians like those who presented today are doing. It connects their work in the lab with the people across the country and around the world whose lives will be utterly transformed by new treatments and especially by a cure. And making connections is what this work is all about. Connections between people, between research teams, and between institutions. This symposium gives us a glimpse of what can grow when the right people, all of you, connect in the right place at the right time. And I would say for the right reasons. This Indianapolis campus, soon to be IU Indianapolis, is the right place. Here, our strong history of scientific and medical discovery sparks with energy, ideas, and innovation. Our School of Science is situated in the heart of the expanding science and technology corridor, which will be one of the defining features of our new IU Indianapolis campus. Our city as a whole is home to a vast healthcare network, including Riley Hospital for Children, less than a mile from where we sit today. Tied to that network is our thriving bioscience research and pharmaceutical industry, including Roche, Eli Lilly and Company, 16 Tech, where ideas, treatments, and cures move from the bench to the bedside. Our campus has long been known for translational bench-to-bedside research, with programs like the statewide Indiana Clinical and Translational Sciences Institute and our campus-wide Center for Translating Research into Practice. Our researchers translate and apply observations and discoveries in the lab, community, and clinic into life-changing diagnostics and treatments that improve health and save lives. This focus on results breaks down walls between departments and schools and encourages the kind of multidisciplinary, convergent, and multi-institutional collaborations that we see at this symposium, as well as in other schools and departments across campus. In this case, that kind of bench-to-bedside collaboration is key to our progress. We envision the work being done right now at the new Center for Hydrocephalus Research will lead to clinical trials and ultimately to treatments for patients. All of this relies on the proximity and collaboration that exist on our campus. Our symposium attendees range from scientists in our biology department to medical researchers and clinicians, as well as patients and their families. Our team of experts and our track record of diverse community building successes make IU Indianapolis the ideal institution to spur progress on hydrocephalus and other chronic diseases. For me, and I think for many others, stories like the Finlaysons serve as a powerful reminder of our purpose, the reason why we do research. It's about improving people's lives. These stories link our research to practice and inspire us to work even harder to make that next discovery that could lead to a cure. With IU's $250 million investment in biosciences announced this past Monday, now is the time to continue building connections that strengthen our community of researchers, clinicians, and supporters. There's no limit to what we can do, what we can achieve together. This is truly an exciting time for research here in Indianapolis, and I want to thank you all again for being part of this symposium and for helping us build this important community. Thank you.
I know I'm supposed to be doing closing remarks, but I think that our Chancellor has beautifully summarized all of the excitement we're feeling here in Indianapolis with the changes that are coming, and we hope that the research corridor is very successful. And I thank all of you for being here and for participating in this first symposium. I hope we have more to come. I'm looking at the people that had to organize it and say, you're going to be there, right? But thank you all. We now have refreshments set up. We'd like you all to join us and to thank again the speakers for their powerful messages. Thank you.